Hi everyone, welcome to the Her Sacred Place channel. Today we will be discussing Yoni pearls. I know a lot of you use them or thinking about trying them. Make sure to watch this video either way. If you haven't already, make sure to like this video and hit the notification bell so you will be notified each and every time I upload a new video. Alright then, let's talk about Yoni pearls. Yoni pearls are usually advertised as vaginal detox or vaginal cleanses. They contain multiple herbs wrapped in a small mesh cloth that is to be inserted into the vagina. Although they are advertised as treating a variety of health concerns such as toxin buildup, yeast infections, bacterial vaginosis, fibroids, endometriosis, or cysts, unfortunately, use of the pearls are a bit complicated and should not be used by everyone. First and foremost, if you are suffering from vaginal itching, burner, malodor, or green or yellow discharge, you should immediately seek out a medical professional. You may have an actual viral infection, bacterial infection, or sexually transmitted infection that needs medical attention along with antibiotics. It is important to remember that some untreated or improperly treated infections can lead to much more devastating problems such as PID and infertility. Now on to Yoni pearls. There are many advertisers claiming different ways to use the Yoni pearls for different so-called treatments. All are consistent in stating that the use of 3 pearls equates to 1 cleanse. While the so-called treatment of less severe problems such as heavy menstrual bleeding is usually 2 to 3 cleanses, more severe problems such as fibroids or endometriosis can warrant up to 8 or 12 cleanses. Most women mistakenly believe that all 8 or 12 cleanses should be done consecutively. This is dead wrong. When it comes to using pearls to treat fibroids or cysts, it is commonly advertised to complete up to 8 cleanses to rid yourself of these particular ailments. There are a few things to note about this, however. The use of Yoni pearls is not a cure and should not be thought of as such. While some have success, much more women do not, and the use of so many cleanses causes other problems. In fact, a woman should only perform 1 assisted cleanse per month. Let me say that again in a different way. You are only supposed to use 1 cleanse within 1 menstrual cycle. If you need a recap on what constitutes a menstrual cycle, please watch my video on ovulation. I discuss the menstrual cycle thoroughly. To get back on topic, however, only 1 assisted cleanse should be performed each month. So if you are to believe up to 8 cleanses will help you with fibroids, it should take 8 months of cleanses before seeing full results. Most women do not understand this when deciding to use Yoni pearls and may cause adverse vaginal problems from Yoni pearl overuse. One of the most common questions I get about Yoni pearls is, are they safe to use? It is commonly known that leaving things in our vaginas for long periods of time is dangerous because bacteria can build up on the objects, leading to a rare but dangerous medical condition called toxic shock syndrome, also known as TSS. Most women have been warned not to leave a tampon in for more than 8 hours because it could lead to TSS. Also, people selling Yoni pearls recommend leaving them in for 24 to 72 hours. Personally, I never recommend leaving any Yoni pearls in past 24 hours. I typically tell my clients to insert 1 pearl before bed 5 to 7 days after the last day of their period. 12 to 24 hours later, remove the first pearl and insert a new one. 12 to 24 hours after that, remove that pearl and insert the last one. Having 1 pearl in daily for at least 3 days equates to a full cleanse. I have found this to be the safest way to use the Yoni pearls, and I commonly refer to this as the mild method. Please do not insert more than 1 pearl into the vagina at one time or leave it in for more than 24 hours, as this is not recommended. That is definitely unsafe. Another common question that I get is about the discharge that comes out after a cleanse. Most women ask me, isn't that a sign that it is working? Unfortunately, not always. In some of the photos that you see for Yoni pearls, the thick gray discharge is labeled as a sign that it's working. But in reality, foul-smelling discharge that is green, gray, or yellow can be a sign of an active infection, which we already talked about earlier, and that you should definitely seek medical attention. It is not a sign that the Yoni pearls are actually working, but that you may have a true active infection. Speaking of infections, always make sure you wash your hands thoroughly when inserting or removing the yoni pearls because bacteria can attach to the mesh cloth and be introduced into the vagina, leading to an infection, which we do not want. Remember what I said before? This is a sign that you should seek medical attention. Another common side effect is cramping. When there's something inside your vagina or uterus that your body thinks shouldn't be there, the uterus contracts and tries to push it out. This is similar to a period when the uterus is pushing out old blood and tissue. These contractions can cause painful cramping. If you ever experience severe cramping when using a yoni pearl, immediately remove the pearl and stop use. Do not use yoni pearls if you suffer from or ever suffered from pelvic inflammatory disease, also known as PID, extreme or mild vaginal dryness, or toxic shock syndrome, also known as TSS. You should not use yoni pearls if you are currently menstruating, which means on your period, or even spotting or any type of blood flow, or have any type of blood flowing from the vagina, or if you are pregnant or think you may be pregnant. All in all, yoni pearls can be used for good reasons. However, it is important to understand who should be using pearls, who should not be using pearls, and the correct way to use them. If you are concerned about your vaginal health in general, make sure you talk to a healthcare provider. They can answer any questions you may have about what's normal and what's not, and let you know if there's anything that you should be concerned about. Just don't go into the idea of using these yoni pearls to cure yourself of anything or to rid yourself of anything without knowing the possible side effects or the harm that they could potentially cause to you and your overall vaginal health. In fact, having some vaginal discharge is completely normal. The color and consistency of it actually tells us what is going on with our vaginal health. Discharge that is clear and has a consistency of an egg yolk is completely healthy, and the majority of people experience an increase in it during ovulation every month. To keep your vaginal biome healthy and balanced, don't use any dishes or soap inside of your vagina. Instead, use unscented soap on the outer labia or vulva, the part that grows your pubic hair, and let water run over the rest. hersacredplace Yoni soap is a great choice to use for this purpose. I hope you enjoyed this short video on yoni pearls. If you like this video, please be sure to give it a thumbs up and hit the notification bell so you will be notified each and every time I upload a new video. Leave a comment below if there are any topics you would like me to discuss in the next video. Until next time, take care of your most sacred place.